All right, Experience Miracles parents, welcome back to part 2 of our powerful conversation with Leah Wilson from Stand for Health Freedom. If you missed the first episode, go back and check it out. We unpacked the why behind the movement and the urgent right now need for parents to stay awake, aware, and take action. But today, that's what it's about, taking action. It's go time. We're talking about what parents can do, practical, powerful, real-life steps you can take to protect your family's rights and help others in your community do the same. Whether it's school policies, medical freedom, or speaking up at the right time and place, Leah's going to walk us through how to take action without fear or overwhelm. This is the episode that turns awareness into advocacy and action. Let's dive in. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. What are some of the most important rights that parents, unfortunately, don't even realize they have?
Do not question your instincts as a parent. You know, your child comes into the world with their own birthright, with you as their parent, you as their primary advocate, their long-term advocate, the one that cares uniquely about them for their long-term success without any ulterior motives, and so there's just such a unique position that we hold in understanding that. But I will say that it isn't super simple when it comes to big M medicine and navigating your parental rights, because in this world, the experts are put on a pedestal, and heaven forbid you end up in court with whether or not you made the right decision for your child, that who they're going to call in to testify is some licensed specialist from the medical system to say what is and is not negligent. And so parents need to understand that choosing their practitioner is one of the most important decisions they can make. And how do you choose a practitioner? You figure out how you view health. What are your goals? And I always like to use the analogy of the football field. If you are standing at the crossroads at the 50-yard line, let's say, this goalpost is complete vitality and wholeness, and this goalpost is you're dead. You're at the 50-yard line. You got to change something. Mm-hmm. Is your goal to pursue healing, to get the ball down the field closer to healing? Then you need to find a practitioner who believes you can heal, and who looks at the body as capable of healing and as a self-healing, not machine, because we're fountains, not machines. But, so first of all, choose your practitioner.
You need to sprint in that direction towards that goalpost.
Towards healing.
Because it's the same way of moving away from sickness.
And diagnoses don't move you closer to healing. They keep you where you are. And they treat where you are to allow you to maintain your status quo. And you could tell us story after story about what that looks like to maintain status quo. It's
the ticket into the system, and it's the thing that often tethers you the deepest into it.
Right. So choose, your practitioner, a practitioner you can trust, and when you're in the emergency system because your child has broken a bone or something, then you have to understand why you were there, and to respect authority while you are there, and to graciously say yes and no. Because the minute you seem inflamed or upset over any medical decision is when red flags go up of, is this parent fit to take care of this child? Yeah. And I don't know if this is the direction you wanted this to go, except for we're looking at making one of the projects that we really are looking forward to is a whole course on navigating medical care for your child. Because do you know the number? This is not a popular term, and I hate saying it on your podcast, but do you know the number of calls we get for medical kidnapping? It's just like, and if you can
doesn't say it, who's going to?
If you can get to those parents beforehand on how to navigate your child's care, to exercise your rights, because it is your right to say yes and no, but you're up against a system that believes the experts know best. And
this is a difficult job to do, period, in today's world. when you are inside the hospital and inside the medical system, this already difficult job. And we don't say that, everybody, to scare you. We do that to arm you and equip you and resource you and empower you and support you and come alongside you. We're telling the truth because you have us. Well, first off, let's go in order. You have what God gave you. You are your child's fiercest, strongest, most intelligent, incredible advocate. So you have your family. You have your child is pre-programmed by God to be healthy. And you know what else you have? You have us. So we're telling you this to be ready when you need to be ready. But yes, the job to stand up and protect our children's health and freedom, I think it's difficult in the day-to-day. And having spent 6 weeks in the NICU and having helped so many families navigate the medical system, the job does become more difficult when you are inside the system. And they may be simultaneously saving your child's life while you need to keep them away from further embedding your child into those two things can exist at the same time. And so it really is the place to become when you're there and you are blessed to be informed and you are able to stay calm, to stay strong. Goodness gracious, that's what your child needs.
Absolutely.
Wow.
And you are your child's primary advocate. And that goes, for their health and education and spiritual and emotional support.
Yeah.
And it just blows my mind that the government doesn't blink twice at you being their financial support. But yet, so it's just the fact of the matter is that we also need to be talking to our kids about their health decisions because there are other adults who also want to talk to them about
sure
that.
Is.
And if you're teaching your kid why we make the decisions we make for our health, how to view your body, you can speak to this way more than I can, but the first time your baby gets a cut and you tell them, watch, the body is going to heal that. Yeah. And you teach them to honor and support the processes, then they will be equipped to be their own advocate as they get older and older, become young people.
And it helps them. Honestly, you're not only giving them a scientific, if you will, it's kind of like homeschooling science class, yes, but it's really an anatomy and physiology and neurology class, but it's really homeschooling philosophy class. Mm-hmm. It's really homeschooling religious class, or I would call it faith class, not a religious class. And it's really just like, this is how we're made. This is literally how we're made. And so now your kids become empowered and obsessed with that and excited about that. So what they do is they move towards that. And I want to come back to this because I love your football analogy, your football field analogy. I have always spoken to our team, to our patients, to our community. I think I've gotten to this a few times on the podcast, but perhaps my favorite strategy. And when I say this, I think everybody will really have a good context of the framework I love to teach from, how God made me. I am the fiercest advocate ever about moving people towards the goalposts you were talking about, towards we believe our children to be healthy. The power, resides in the nervous system and moving towards that empowerment, moving towards that vitalistic, mentality of it. And so that direction, this is just physics. I'm such a nerd, Leah. So I love science. I love physics. So even when I'm talking philosophy, I still have to bring science into it somehow. The physics of that is you can only be moving in one direction at one time. So if you're moving towards better health, if you're moving towards healing, if you're moving towards empowerment, you are simultaneously moving away from sickness, away from disease, away from fear, away from taking your choices away. So really, parents, it's some of us are, and it's just how God made us. Some of us get riled up about going against things, and some of us get riled up about going towards things. And guess what we're both doing? Going in the right direction when we do. You know what I mean? And so no matter which of those goalposts, if you're looking at that analogy Leah gave us and you're like, I got to get away from that goalpost, awesome. Use that energy, use that motivation to move towards the other goalpost. But also know that if you're looking at that and you're like, that's the desired outcome I have, that's what I want, I got to sprint in that direction. So you're so good at this section. You actually answered my second question before I even asked it. You are a podcast maestro, my friend. Because my second question is, what advice would you give mom and dads who do feel powerless in their medical decisions? And it's really about choosing the provider. You went right to it. Choose a different doctor. Choose a doctor that aligns with your philosophy, that does provide informed consent, that does take the time to educate you, inform you, and empower you, that does work in partnership with you. Is that not the single biggest thing you see changes families' lives when they choose different doctors?
Absolutely. People want to know. We get the question all the time of how do I find a provider who will allow me to make decisions? And we say, well, first of all, if you're in a situation where the doctor does not respect your desires for your health, that's one you need to get out of.
It is.
And sometimes that's hard for people. they've learned to establish themselves within, change is hard, but making that leap is worth it. And identifying your own health paradigm and what practitioners will come beside you in that paradigm. And I was sitting next to my son, Samuel. My kids, I don't know if yours are like this. They think that we're watching bad, like R-rated TV when they see drug commercials. Oh. They think that the drug commercials are R-rated.
Blown away by it.
They're like, well, you're watching a show with drugs on it. And so Samuel, my 8-year-old,
true.
He said there was a long list of side effects on a drug commercial. And he said, Mom, I would never touch that. And it hit me that the reason my 8-year-old has that conviction, God love him and all of his innocence, is because he already knows there are options. He doesn't feel stuck. And when we feel stuck, we have to go looking for resources. And when, you know what I mean? And so
beautiful.
It's
everything.
If you understand that there are options, then you can pursue one that aligns with your desires, goals, and deeply held beliefs and what is best for you and your children.
So there is a lot of incredible, impactful things we could, put and say, okay, this is what Stand for Health Freedom. This is what Leah and this incredible organization does. But you fight for options. You fight to let parents know you have options. You have a choice. And then you empower them with the right information. Not the right information. That's not the right term. Then you empower them with information that they can filter through their paradigm, through their philosophy, through their lived experience. And then they can make their best choice for their child. And honestly, that's all every single one of us wants. And that's where good things come from, is that ability to make the choice. Okay, so let's go here in this last section, my friend. I was so fired up for this. I almost knew I would be like extra, in a good way, in a very healthy way, nervous to get into this because I want to know more. I want to help more. I want to support more. I just don't want to feel like I'm sitting on the sidelines. And I think, I know our crew really, really well. I think they definitely share a lot of our wirings, right? And want to step up and get into this. So what are ways that families can practically, actively take action to get involved with this health freedom movement? We know now after this conversation why it's so important, why it's so essential, what it looks like. How? Take us into action. How do we actually get involved?
Mm-hmm. So we endeavor to, and I just want to say this one thing about just going back a little bit, to frame out the trends where the people are the stakeholders and can have the most impact at any given time. So we all have battles ahead, and you can get on there and you can see what are the battles ahead, where are we together going to use our voice and shape policy so that we can minimize unnecessary suffering. That's why public health policy matters, is because people matter and our future generations matter. And you can join standforhealthfreedom.com and acclimate, be able to identify those issues, share about those issues with people that you care about and that are in positions of influence. But when you get emails from us, when you join standforhealthfreedom.com, read those, because most of the time there's an action alert and you can click and take action. And that action, if it's in your inbox, matters. It will be relevant to you either as a U.S. citizen or as your state resident, or sometimes even as the district within your state, or
you do such a good job of matching information to the action that affects that person. And that family. I've noticed that. Yeah.
That's why a
brilliantly built website with a wonderful human that we both love massively, Charlie and Jim. Absolutely. Yeah.
That's why our partners, yes. The website, love them. Yep. That's why our partners who support us matter so much, is because the geo restriction, the ability to get that message to the right person at the right time who can make a difference on that issue, is what makes our voting block powerful. Yeah. And that's what has allowed us to secure 117 and counting policy wins as a voting block. Yeah. And once you get the emails, you take action, you share those with friends, then we always have campaigns during voting season for Vote for Health Freedom. Yeah. So then you're going to be engaging with making sure that everyone on your ballot gets the survey, so we can know where they stand on health freedom. They can show up on the Vote for Health Freedom voter guide. That's one of my favorite parts, is when we get pictures of people using their printed out voter guide at the polls. Yep. And we have over 1,300 health freedom candidates in office because of listeners like yours
Beautiful.
who have voted in people. And that's why we're starting to see so many massive shifts, is because when you participate in getting the right people in office, then the conversations can be had that need to be had in office, in the halls of government. So it's this wraparound, comprehensive thing that we try to make easy for everyone.
You do make it easy. You do make it easy. Because I've been in this space for a long time, Leah, and it has never been easy until your organization came in. I have literally stunk. I'll be very Tony English, Iowa. Again, I tell you, I have been an absolute turd in the game of advocacy and stepping up in public policy and supporting my community, my state, my country, because it was so complicated. I'm not making an excuse for myself. It's just my lived experience where it was like, oh my gosh, I would take a step or two forward. First off, I would have no idea like what first step to take. That's why I was really pulling on that thread earlier with you, learning what yours were. I didn't know what step to take. And now I know that God, I overcomplicated it. I just need to get with the right people, right? And join the right organizations. But then I found that a lot of other organizations, I just have to say what it was. It was never easy. It was so much work, right? And I knew the work was worth it, but I also knew that I was buried in my other work that was worth it. And so what I love so much about your emails and about it is just the ease of application. I always tell Christina and my team, I'm like, I'm the hardest working lazy person ever. Like, I love ease. You wouldn't even, people think I'm probably a crazy person and like, no. I love easy street like none other, because you can take more impact and make more impact with that. All right, my friend. Next, what do we call this? Line of questioning for you. And it's going to start with a little bit of story, as I tend to do, to kind of frame up my questions here. So I have been blessed, you and Nick and your crew and the tribes we've been a part of within natural health and chiropractic. We've been blessed to be, we can call it a couple of different things. And then you, my goodness, with your career, we have been in the trenches. We have been on the front lines. We have been in our communities serving people for a long time. We've also then gathered. We've gone to places like CalJam, and we've gone to these different seminars where we all meet each other and we support each other and we pour into each other. We get, educated, we get informed, we come back to our communities, and then we educate, inform, adjust, and change lives that we can touch directly. That has always been the mode of operation, I think, for people that exist like us. At so many of these seminars at CalJam, I got to, I would talk about birth trauma and the perfect storm. I got to go on stage and do those things. And I would get to meet backstage. I would get to meet RFK Jr. I would get to meet Del Bigtree. I would get to meet Joe Dispenza. I would get to meet these incredible, Sayers, Joe Mercola, I got to meet all these people. I got to have conversations with them. And so when you get to know real people, here's what I can tell you about everybody I just named off. My goodness, are they real people? My goodness, are they heart and soul and convicted and caring and compassionate and brilliant people. And I wish I hadn't done it. Now there's a lot more people we could add to the list too, right? Where I'm going with this story that leads into a question is, I believed, I will share authentically with you, my friend, I believed that whole time, the whole time I've been in these circles, that we were doing good work and that the work was quantifiable and that it really was making an impact and it was making a reach. I also understand things in a big picture, and I felt like the whole time it was also limited. Like, goodness gracious. We'd watch those seminars, there'd be 3,000 of us, and I'd be mad that there wasn't 300,000 of us, 3 million of us hearing from these voices, right? And these advocates in this movement. And so I did my best that whole time, Leah, to come back to home base, if you will, and share their messages with that. Had you told me 5 years ago, let's go to 10 years ago, 5 years ago, 10 months ago from recording this podcast, that the people that I know the truth would be a part of the current administration and be in positions of impact making, health freedom expanding, chronic disease in our kids reversing action. Had you told me that, there's nobody who's more glasses half full, sunshine and unicorns than me. I'm the happiest guy, positive vision guy ever. You guys have known me for a long time. That's how I'm wired. And even I would have been like, you're full of it. It ain't going to happen. Even I probably would have been a friggin' doomsdayer, right? And been like, no way. They're not going to let him in. Not going to work. And now God has said, wrong, Tony. This is happening, right? It's so So that's my long-winded Tony story to say I have been so in the most blessed of ways watching this all unfold over the last few months with a healthy dose of disbelief. And at the same time, if I just calm my craziness, I look at it and I go, oh yeah, we actually have been doing the work required to make this happen. And the most important work that we did the whole time, every one of us that is in this, I don't know what to call it today, coalition of health freedom movement, every single one of us, we actually all did the same thing the whole time. We just gave the voice and the choice back to the parents. That's what we wanted to do. And so it isn't about what he's done or we've done. It's about what parents collectively unified have done. It's a parent-driven movement. So first off, I'm going to let you rip. What do you feel about this? What do you see about this? And then you have such a great strategic brain. Can you break it down for us? How did we get here? And then where can we go from here? Why does this matter? How did we get here? And what has you excited about the future of our kiddos? Let it rip.
So with Stand for Health Freedom, we've been beating a drum since inception that if we can get to 3.5% of people standing up for this issue, we will not fail, because that's what research shows. Harvard research shows that 3.5% is the tipping point to shift the tide. So we said, come on, let's build this to 11.5 million and shift the tide in America for health freedom. Well, I truly believe that now we are there at the tipping point. It's purely operationalizing it.
Okay.
And that's the beauty of it. That's the beauty of, Secretary Kennedy being in the position that he is in, is that we are positioned, thanks to your work, thanks to the moms and dads who used their voice, who found their tribe, who moved this story forward and made this a priority, made the people stakeholders in government and in public health again. Thanks to all of that, we are in a position to operationalize, and that is going to require undoing a whole bunch of things about the broken systems. And it's going to require, using our voices continually for the policy changes so that these have a lasting effect and it outlives the current administration. And I think that we're in a really good spot to use this energy, to use the truth, to use the window of light that we have. I mean, I'm always so encouraged when I hear little things like Bobby said the other day, something about we're going to, the autism, that we're going to look into all the factors. And in one conference, I need to go back and find it, I even heard him say, like ultrasound.
Yeah.
And
see, now that's something I would love to chat about, and we can talk at dinner, because I have an entire letter, because it can't just be about toxins. It needs to be about ultrasound, fertility distress, maternal distress, and birth trauma. You know what I mean? Oh. Sorry, I don't want to take us off topic, but it needs to be a complete answer, right, not a compartmentalized answer. Yeah.
And as health freedom, some people are nervous that we're going to empty one nanny state and fill it back up with a different power vacuum. And that's not our goal as a health freedom movement. Our goal as a health freedom movement is to restore transparency so that people can make good decisions.
That is your movement. Yep.
And with transparency is key, funding is key, properly operating agencies are key. And I believe that Secretary Kennedy and his boss, President Trump, have those things in mind.
I do too.
And it's our job to support that, to operationalize it in our own states, in our own towns, keep having these conversations. Yeah. I was also encouraged. I heard him talking on Dr. Phil, and he said it very plainly and very clearly that sugar is horrible. It feeds obesity, it fuels cancer, and it keeps chronic disease and inflammation high in our population. And you know what? How much of a contrast that is with prior heads of health and, human services.
Who would say stuff out loud and you were like, you can't possibly believe what you just said, right?
The direct contrast in 2016, there were documents uncovered that our government, top CDC officials who were former VP at Coca-Cola,
always are,
were colluding to prop up research that blamed lack of movement for childhood obesity and buried research that said that sugary drinks fueled obesity. Yeah. And now we have a secretary that's saying sugar fuels obesity, and we're not going to lie about it. It doesn't matter if Coca-Cola pads our pockets. It doesn't matter. The CDC is helping pay for research to fuel Coca-Cola's campaigns and vice
What we
versa.
have to do is be transparent and share the information, which is
Correct.
black and white. And again, share the science one way or another transparently. That is all that is. Transparency is the key to all of this. And it's so important. But again, just homie to homie here, my friend. Did you see this coming?
No, I mean, I don't think any of us could have written this.
I don't think so.
Like God did.
But
and even Bobby himself has said, this wasn't my goal. This wasn't what I saw in the future.
No.
Right. And granted, I mean, he is leading the charge as the head of health in our nation right now. However, I believe that his heart and ours as a movement is to put parents back in the driver's seat.
Every single conversation I've had with him, whether I'm watching it from a stage or we've been blessed to be at these dinners and have these conversations, that is literally the foundational approach he takes is we shouldn't be in charge, meaning the government. The government, the CDC, the pediatrician, doctors, teachers should not be in charge of your children. That is just not a path. We've had it that way. You can just look at the data. That has been how it is. They've been in charge. They've been mandating things. And the latest round of mandates where they went the hardest down the mandate road was the worst thing that's ever been done to our culture. And guess what? They woke everybody up. They overplayed it. And I called it, I can remember March 2020 sitting where we'll go there next over to the office and I'll show you the room. I remember gathering my team in the back room. Everybody was in obviously crisis, emergency, stress, fight or flight. And I had this just God-given, through my experience and however my brain is, I had this God-given sense of calm. I think the team reports back, they're like, you were almost smiling and nobody should have been smiling at the time. First off, keyword, you could see us smiling because, our faces were revealed the whole time. But so you could see my smile, whether I was or wasn't. But I told the team, I said, this is going to really suck for a season. Okay. We're going to have to really support each other. We're going to have to really pour into we do it now. We support each other right now. We pour into our patients right now. We educate our patients right now. We empower our patients right now. We provide informed choice right now. We adjust our patients right now. But it is time to double down. We're going to triple down, 10x down. We got to love on our people and support them like never before. And what'll happen in the big scheme of things, I literally remember drawing it on the whiteboard. I said, they will overplay this. They will push. It's already been brewing. The Titanic, Leonardo DiCaprio and Kate Winslet or whoever that is, they've already been out on the deck singing and the band is playing and they're going under. Because I'm a future guy. I remember I gave you the tour earlier and I was talking about what I want to do with this later. I wasn't even talking about what we do now. I am so in the future. Christina calls me future man. She's like, can you just pay attention to what we're doing right now? And I was like, I don't think that's what God wants me to pay attention to. I need your help to pay attention to what we're doing right now. So long Tony Rambo to say, I saw that coming. I saw parents waking up to Big M and medicine and are back to our tours away. I saw that happening. I saw millions of parents, ready to sprint in the other direction from the pediatrician and the medical system. They were already leaning towards the goalposts, and then COVID just, all that BS just shoved them in that direction. Policy-wise, though, in positions of power and influence, that got me. That one I didn't see coming. And I am just so grateful to God because, again, it is just opportunity for impact.
And it's not just HHS. It's happening at every level of government. Yeah. And we can leverage.
Happening locally, it's happening. Right. Yeah.
And we can leverage the stories that come from HHS in order to inspire and give permission at the local level. But the way that our country is set up and our freedom is secured is that your state is in charge of your public health and welfare. Yep. That they are the ones, your individual state is where you will have the biggest impact for health freedom, for parental rights, privacy, free speech, informed consent.
By a large margin.
That's where it resides. Yeah. And so getting involved in your own state and where you live and protecting those walls, starting at home, like you said, that's the primary function of government is within the four walls of your own home. And that's the beauty of it. And, Secretary Kennedy has been propping up and supporting individual states who are making good decisions. And we need to see these states pandemic proofed because another pandemic will come. Yeah. Yeah. It's too big of a playbook. It's too lucrative a playbook. And international agencies, NGOs have already shown their hand that we will all cooperate and be good global citizens.
They tried a few even before that one. They tried a few that didn't quite work at the level they wanted before the one did.
And the question becomes like, why did this one work?
Yes.
And I think a lot of it's technology.
Yeah. But you have to deconstruct that in order to prepare to not have the next one happen. You do got to study. I've said that to chiropractors all along. Like, guys, stop complaining. Stop sitting around whining and complaining and being grumpy about this. Put on your glasses and study what worked. How did they get away with this? They have the most horrendous, inadequate, ineffective. If the pediatrician and the general medical approach to pediatric health, if it was just neutral, okay? If it was just, not helpful, but not harmful, that would be one thing. Their product is actually harmful, significantly harmful. And yet there's
cause of death.
Exactly. And yet they're still in charge. So you have got to have one heck of a marketing, communication, coercion, public policy. You got to have one heck of a strategy to force a dangerous, deadly, ineffective product onto the market. So I say that as a strategist, study that, deconstruct that, reconstruct that for good. And let's see, that's what we're doing with this podcast. That's why we have this voice. We know we can reach people and move them towards this direction, which will take them away from that.
Do you follow the AAP?
I do, yeah.
Okay, so the American...
And I am a sucker. I get everybody's emails. I get all the research emails.
Have you seen memes lately? They are freaking out. The American Academy of Pediatrics is freaking out right now because they said in the New York Times, they quoted, I think it was the president of the AAP said, parents are anxious and confused. There's a big problem. So I was like, what is she talking about? So I went to the article and then I went to the Facebook page to see what is this woman? I think her name's Susan. What is she talking about? All these pediatricians are saying every single well visit takes an additional 15 minutes to convince parents that vaccines are safe. And I'm like, praise God. Parents are asking questions. Parents are declining. I mean, are they even going to tell us the truth about vaccine rates? In a few years, they've
shown their card. They're literally just, they're at this point, I always use this analogy. I love this. This is such a fun over. So the way I look at it is, we have kids, right? And so my kids, my two little girls, they are amazing. They are either 1000% in love with each other, having fun, and at a moment's notice, they're smacking each other and throwing down. That's called being a sibling, right? I will watch one of my beautiful little girls smack the other kid. Like I have my own eyes, and I'll be like, I just watched you hit your sister. And they're like, no, I didn't. And once they come up with a lie, and the moment that little kid puts the first lie out there, they're not backing down. They are just digging in, and they'll come up with any and every. They'll just stack the lies and stack the lies. You would like to think that in this moment where the gig is up and parents know and people know that they would be like, you know what? Let me answer your question forthcomingly. Let me answer, you know what? You do need to go see a pediatric chiropractor for this. You know what? You do need to change your diet and nutrition after this. You would think that that's the direction we're at. I think they're only going to fight back harder until they are literally just...
The enemy will destroy itself. We do not have to destroy the enemy. That is not our job.
I don't think
it is not our job. And our job is to allow people to see the truth and to choose the truth, and the truth will win. I mean, we see it over and over, Tony. I mean, I just have to tell you a really short story. Does the people's voice matter? Absolutely. That's the 117 policy wins that we have. Yeah. And just today, we are launching a national campaign to get fluoride out of the water because of the recipe for success that we have built, the Stand for Health Freedom Way. And in Florida, we got fluoride out of the water. And I believe it was, don't quote me, it was 24 towns and counties, I believe. And then Miami-Dade took up the torch. Miami-Dade's a huge location right in Florida. So Miami-Dade takes up this torch to get fluoride out of the water. Their commissioners vote. The commissioners vote yes, stop the fluoridation, 8-2. So 8 say yes, we're going to stop fluoridating. 2 say no. Guess what? Their mayor vetoes it and says, we will keep fluoridating. Then a week or so later, Florida passes a state law that says we, with the help of Stand for Health Freedom, that we are no longer fluoridating the entire state. You cannot fluoridate water in the state of Florida. And you know what the commissioners did in Miami? They brought it back for a vote to override the mayor's veto. And they said, we're going to listen to the people. The people don't want the fluoride. We're overriding this veto, and in Miami, they told the mayor, this corrupt power isn't going to win the day anymore.
And is there anything more simple, profound, and powerful than that? We're going to listen to people. And is there anything more American than that?
You know, and I think your listeners probably know, but they might not, that fluoride has been a decades-long process or practice, putting fluoride in the water, even though they cannot show you a single benefit of ingesting fluoride. It's a topical benefit of putting it directly on the tooth. And now the EPA and the latest federal court cases are admitting the decline in IQ from exposure to fluoride in especially infants and young children. And so it's only common sense to admit that we need to stop fluoridating. And who's opposing this? The industry, because there is money that, you know, where this fluoride comes from.
Well, and there's also precedence when these ducks start to be moved in the right direction. When the chips fall, builds momentum for the next one and the next one, which is what we have been working for and fighting for this whole time. Speaking of the chips, the last thing is, that we need to work together and do. I need your help making this happen. We all need to just help each other in all this. We need to make sure that report that comes out about autism and chronic illness, that it includes a conversation about subluxation, that it includes a conversation about the nervous system and birth trauma. And so it's the one thing I know for sure. God put me here to enter all of these conversations and bring informed choice and bring education and awareness and empowerment and action. But if there is where the crosshairs of my laser focus is, it's into the nervous system and it's into subluxation, because what we see all day, every day in clinic is a lot of families awesomely have found their voice. They have changed their lifestyle. They have done so many things, but there's nothing that any parent can do themselves about subluxation. There's nothing any pediatrician or other professional of any kind can do about subluxation. So in these public health policies and in these answers that are put forth, we need to make sure the answers are complete, and they will not be complete without that conversation.
Without nervous system balance. And do you see it trending? Do you see it on TikTok? And I'd like to think, nervous system balance is trending.
Do you think, can I just ask whether this goes in or not? I don't know. I'll leave it to the team, because, I'm such a hard charger, and God has given me such faith and such conviction, but it is going so well right now. I just almost have to ask these questions. Do you think the work we've been doing is working? Do you think we have something to do with that? How much our platform and this voice has really pushed the nervous system into the conversation? I'd like to think it does, but sometimes you just are like, I don't know, you overthink it.
Without a doubt. And it's 100%. I think, you might say that 50% of the change is simply public education. I would venture to say it's way bigger than that it's 90%. And I know that you educate through this podcast. You educate your patients. You don't just treat them and send them home. No. You empower them to understand the body, to understand science, which is physiology, it is. And to neurology and nervous system balance. And that public education is a huge part of change. And that's what we've done. And that's what we're going to keep doing.
Yeah, we are. And it feels so good to see the lives transformed from it. It is so fulfilling. It is so impactful to experience the miracles that come from it. And then to know in this moment right now, we have momentum, plenty of work to do, plenty of work to do. The work begins. And we love work, don't we? We're a little bit crazy, aren't we? All right, everybody, that was an incredible, just multi-pronged, multifaceted, in-depth, change our kids and families' lives interview, as I knew only you could do. We are so blessed. You came here to do this with us. You are such a world changer. You, your boys, your family, I can't wait for all that's going to come from this. This is just our first conversation and our first official collaboration of many to come. So everyone listening, we are going to absolutely, and I say this in my style, we are going to stalk you with their website. We're putting it in the show notes. We're DMing it to you. We're going to email it to you. Get on that website. Get on that list. Get into action. Get into advocacy with Stand for Health Freedom, because we stand right alongside them in this mission and are absolutely on Team Leah. Let's go. Thanks, everybody.